Déclaration de ministre.
Statements by ministers.
Prime Minister.
Thank you, Mr. Speaker. In February last year, the coronavirus disease discovered in 2019 gave us a new word, COVID-19. But even as COVID-19 took hold of our planet, even as this new word took over our lives, we found ourselves talking about other words, too, about words that weren't new at all. Sacrifice and solidarity, compassion and community. When the pandemic hit last year, these words, words that have defined Canadians for generations, were suddenly given new meaning. It has been a tough year, a heartbreaking year, but it has been a year that we have faced together, and that is something we must never forget. Mr. Speaker, on this National Day of Observance for COVID-19, we remember the people we've lost, grandparents and parents, brothers and sisters, friends and colleagues. Each one was loved. Each one was special. Monsieur le Président.
Mr. Speaker, the pandemic officially turns 1 today. March 11th, 2020 will always be a date for which there will be a before and an after. For family members and loved ones, each death also marks a before and an after. Today, we remember the people who have lost their lives to COVID-19. They are no longer with us, but they are in our memory. Since the major wars of the 20th century, there is a sentence that we use often and that we can use for those that we lost this year during the pandemic. We will remember them.
Speaker, a year ago, Canadians were asked to stay home and stay safe. And yet, even apart, or perhaps because we were apart, our communities became stronger and stronger. Businesses stepped up to produce PPE when we needed it most. Some went from making hockey masks to face shields. It doesn't get more Canadian than that. Students and teachers learned how to do school online, and kids did the dishes while they were doing their homework. Young people across the country stepped up to help their neighbors, to serve their communities. Essential workers made sure the shelves were still stocked with food. People cheered from balconies in solidarity with healthcare workers, the heroes of this pandemic. Brave women and men in the armed forces answered the call of duty for Indigenous communities and for the greatest generation now in long-term care homes. They were there for our parents and grandparents. And through that service, we saw clearly that for every senior in Canada, we must do better. And I know that we will. Malgré tout,
there is hope on the horizon. Vaccination is ramping up. Millions of doses are on their way. It is not time to give up. Mr. Speaker, while people continue to make efforts, I know that they are reassured when they see all of their leaders working together, beyond partisanship, beyond party lines. We are in the midst of an unprecedented crisis. It will take the talent, the know-how, and the ideas of all Canadians to see what the future brings. We will not be able to rebuild a fair economy for everyone if we are divided. We will not be able to develop major societal projects if we refuse to listen to one another. Over the past year, we have worked together to move forward. And this year, we will continue to work together to rebuild.
And community, sacrifice, and solidarity. This is where we find meaning in the depths of grief. This is our light through a dark time. Every Canadian we lost to this virus will be remembered. Every shift done by a frontline nurse, every mask made by a Canadian worker will not be forgotten. We are stronger together, today, tomorrow, and always. Merci, Monsieur le Président.
Thank you, Mr. Speaker.
The Honourable Leader of the Opposition.
Mr. Speaker, today we recognize a somber National Day of Observance for COVID-19, a virus that has caused a crisis of historic proportions here in Canada and around the world. More than 22,000 Canadians have died from COVID-19. Hundreds of thousands have fallen ill, and millions have lost jobs or have had their work severely cut back. Des Canadiens sont partis sans voir leur...
Canadians have gone months without seeing their family and loved ones. A number of parents have done what they have been able to do to help their children out at home. And Canadians must also face a number of secondary effects linked to the pandemic. Many workers are worried about their colleagues' mental health. Thousands of cancer operations have been delayed. Drug and alcohol abuse rates have also increased. Domestic violence is the pandemic in the shadows of the COVID-19 pandemic.
60% more deaths from the opioid epidemic than from COVID-19. Increasing rates of domestic violence have been the shadow pandemic this past year. Youth mental health, presenting as anxiety or eating disorders, are alarmingly on the rise. The true cost of this pandemic on the lives and livelihoods of Canadians of all walks of life has been staggering. And yet, after a year, Canadians still aren't sure when we can expect life to get back to normal again. We all want that. When we can go back to work regularly, see our classmates in school like we used to, when everyone can expect their vaccinations. Les conservateurs veulent que le...
The Conservatives want the government to succeed. Everything linked to the deployment of the vaccines. Our country and our economic recovery depend on it. We must do everything possible for Canadians to be able to go back to work in all sectors and in all regions of the country. Canadians need the government to act, in particular to stop the spread of new variants.
Workers are exhausted. Nurses, PSWs, physicians, and caregivers have put it all on the line for us this last year, and Canadians appreciate your efforts. Rebecca and I saw their hard work and dedication firsthand when our own family had our experience with COVID-19. We want to thank the dozens of healthcare workers at the Brewer Park Assessment Centre for working with us. Merci aussi.
Thank you to José Gauthier as well, our public health nurse. Thank you, José.
Essential workers deserve our thanks and praise. They also deserve our efforts to ensure that we can provide them with more support and certainty in the future. And in the present, they deserve to know when they can expect their lives, which have been turned upside down perhaps more than any others, when those lives will return to normal. Small businesses that have been hanging on by a thread also deserve to know when Main Street can finally be able to breathe a sigh of collective relief. Les Canadiens ne savent toujours.
Canadians still don't know when they will be able to get their first dose of the vaccine. Meanwhile, our neighbors on the south will be able to restart their economy because over 300 million Americans will be vaccinated by May.
Canadians in this crisis. And as we've wanted to see more effective programs, we've still gotten the money and support out the door and worked on fixes after. Like many Canadians, we're frustrated by the slower pace of vaccines than elsewhere, but we want the government to succeed for the health, well-being of Canadians, so that we can get our lives back to normal, so that we can address the unemployment, the inequality, and the strain caused by the crisis. We must also recommit as Canadians to ensure that our country is never again unprepared. We must learn the lessons, build capacity, and ensure a swifter and more effective response in the future. Aujourd'hui, alors que nous
Today, when we see the effects of COVID-19 on Canada, it is important to work together to improve the vaccination plan and the economic recovery.
We pause, give thanks, remember, take a collective breath, and then redouble our efforts to beat COVID and get life back to normal. Let's gather up our true patriot love to ensure that Canada conquers COVID and emerges united and more stronger than ever before. Merci beaucoup. Thank you, Mr.
Thank you very much.
L'honorable député.
The Honourable Member for Belleuil-Chambly. Thank you, Mr. Speaker. It is with the symbol of the white rose, which I took the liberty of bringing today, that Quebec has chosen to declare today a day of observance, because it has been far too long that this crisis has been underway, and we can't wait for the end of it to have a day of observance. We have to say right now to all of those who have lost a loved one that we are with them now. Over 10,000 people in Quebec and over 20,000 throughout Canada have lost their lives to COVID-19. Over 300,000 people got the disease in Quebec. These are not numbers. These are faces. They are people. They are presences that are no longer present. And like my colleagues, I want to stress the recognition that we must feel and the appreciation that we must feel for healthcare workers, for people who also work in education, in the schools, in daycare services as well. And a few days after the 8th of March, I would like to remind everyone that those front lines are mostly held by women. The pandemic has made the most vulnerable among us even more vulnerable. People who are isolated, who live in poverty, who suffer from anxiety, are suffering even more and are made even more vulnerable by the pandemic. The healthcare system is in great difficulty, public finances as well. Fear and distress have become daily for all of us. We keep waiting for uncertain bits of hope. Seniors are distressed in many ways as well. They are the most fragile among us, and they are those who are at most risk of dying from COVID-19. They are the most isolated, and they suffer the most from their diminishing purchasing power. But I have to try to find something positive in all of this. I can't help it. We all obviously know someone who has lost their life to this disease. But we will be bound to understand what's happening and what has happened, to turn to science, to be able then to overcome this disease, to put an end to all of this. Then it will be our duty to put in place measures to ensure that there's economic recovery. And I'm not talking figures. I'm talking the economy as a means of self-realization for coming fully back to life, rebuild our capacity to vaccinate people, our healthcare capacity as well, rebuild an economy that will be richer and greener at the same time, and more generous. I hope that that lesson will have been learned, more egalitarian. We must strengthen our healthcare system without any ideological biases. We will have to look back and see what we did well, but also look at what we didn't do quite as well. Today, however, first and always, we must show compassion. It is compassion that is linked to this sense of privilege that we have to be able to help because we are healthy and because we have privileges, and we can help those who do not have those privileges. We have to feel it in our hearts. We have to feel in our hearts of the people who have heard that things are going to get better, but who, in their own experience, have not seen that. It has not gone better for them. Thank you, Mr. Speaker.
The honourable member for Burnaby South.
Merci, Monsieur le Président. Thank you very much.
Thank you, Mr. Speaker.
When we acknowledge and remember today as the anniversary of this pandemic, it requires us to reflect on who has been impacted by this. We've all been impacted. We've all felt this pandemic in some way. But I want to take a moment to think about those who've been hardest hit by this pandemic, those who have felt the brunt of this pandemic. And it is with great sadness when we reflect on who felt this pandemic the most and who bore the brunt of this pandemic, we come up with the answer that our seniors, particularly seniors living in long-term care, were those who bore the brunt of this pandemic with the worst conditions and with their lives. And it is a national shame that that's the case. I think about so many people, so many loved ones who were lost when their family could not be there with them in their last days. They were lost and families couldn't grieve their loss. And so many preventable loss. It's hard to really think about what losing 22,000 Canadians mean. But there was an incredible event on the front lawns of Parliament that really illustrated what that meant. Normally, when we see protests on the front lawn of Parliament, it's about the presence of people, how many people show up. But in this protest or in this moment, it was about the absence of people, and there was empty shoes laid out that reflected and represented those that we've lost. And we lost so many loved ones. And I think about a man I met in Windsor who talked about his father, who, with a lot of difficulty, decided needed to go to long-term care because of his complex care issues, was in long-term care, got COVID-19 right around the time when the vaccines were announced, and ended up losing his life. And to this day, his son is haunted with the thought of what would have happened if my father got the COVID-19 vaccine. Maybe he would still be there. Donc, quand on pense de cette pandémie.
So, when we think about this pandemic and the statistics, we have to think about who this hit hardest. And it's a national shame. It was seniors in long-term care who were the hardest hit by COVID-19. And we always have to remember that those deaths were avoidable deaths. If the decisions had been made, if vaccination had been sped up, lives could have been saved. So we need to remember that.
It was incredible in this pandemic who put their lives in front of this pandemic, who put their lives on the line. We are so thankful to them. But they deserve more than our thanks. They need to be properly cared for, properly compensated. And we will continue to work for that. Il faut aussi rappeler
we also need to remember that it was frontline workers who were also the hardest hit. All frontline workers, not just healthcare workers, but also those who work in stores, in all kinds of ways. They're the ones who are the true heroes of this pandemic.
About Indigenous and racialized people who have been amongst also the hardest hit. Indigenous communities who live with a constant fear that an outbreak would be devastating to communities that have faced historic and ongoing lack of access to healthcare, and that a pandemic would be devastating to Indigenous communities. To live with that fear and that worry has been just completely wrong. And why we need to make sure in our response to this pandemic and in the vaccination, these vulnerable communities receive the vaccine as quick as possible. And I also want to reflect on how racialized people have been hard hit by this pandemic, that the workers in factories, in logistics and transportation and warehouses, the workers that brought food to us, that continued the supply chain, these workers could not work from home. They did not have that option. And as a result, they were amongst those who were more likely to get infected by COVID-19, who felt, again, the brunt of this pandemic. And in thinking about the impact of this pandemic, we know that it has not only meant the terrible and horrible loss of life, it's also meant a loss for jobs, loss for businesses. Small businesses have had to shut down. And specifically, when we talk about loss of jobs, we know that women have been disproportionately impacted. Women have been more likely to have lost their jobs by this pandemic. And so in our recovery, so that we never let this happen ever again, ce qu'on doit faire.
What we have to do in the memory of the victims of this pandemic is make sure that we take specific concrete steps to prevent the same thing from happening again in the future. So first of all, we need to take care of our seniors. We need to put their care ahead of profits in long-term care. We need to make sure that we have national standards to guide us. We need to benefit from everything we've learned in this pandemic to make sure that our seniors get the best possible care.
Moving forward, we remove profit from long-term care so that our seniors no longer bear the brunt of any future outbreak, pandemic, or serious event. Our seniors need to be protected, and there are clear steps we can take. We know that frontline workers need to be paid a dignified salary so they can do their work, and so that they are protected. And we know that when we have good quality of work, good conditions of work, it directly means better care for our loved ones in long-term care. We need to also make sure we are building resilient communities where we are investing in childcare so women can return to work. We need to make sure we build a capacity to produce a vaccine in our own country, ideally owning that publicly so that we were never in the same situation we were at the whims of international logistics and supply chain issues. Pour prévenir les mêmes.
In order to prevent the same impact from a pandemic in the future, we need to make sure that we make investments in childcare to ensure that women who were the hardest hit, make sure that they can go back to work. We need to have a domestic vaccine production capacity as well, and we need a crown corporation that Canadians control to produce vaccines and essential medications. It's also important to prevent a recurrence of this pandemic, to take steps immediately.
Back to this pandemic, it's not enough to just remember the lives lost or the impact on jobs and lost businesses. We have to also commit to preventing this from ever happening again. And there are steps we can take. And New Democrats are committed to making that happen. Thank you so much. Merci beaucoup.
The honourable member for Saanich Gulf Islands is rising on a point of order.
Merci, Monsieur le Président.
Thank you, Mr. Speaker. I am seeking unanimous consent on this occasion to make a little speech today also. All those opposed to what the honourable member is proposing will please say nay. Okay. The House has heard the terms of the motion. All those opposed to the motion will please say nay.
Saanich Gulf Islands.
Merci, Monsieur le Président.
Thank you, Mr. Speaker. And I'd like to thank all my colleagues here in the House, as well as those joining us virtually, like I'm doing. Today, on this day of commemoration of all the lives we've lost in these terrible times, we now have over 20,000 Canadian men and women who've lost their lives because of COVID-19. For each individual, for each family, we all share the same feelings as those who've already spoken this morning. And I'd like to thank the Prime Minister for his words, as well as the Leader of the official opposition and the Leader and the member for Belleuil-Chambly and the Leader of the NDP.
Want to try to throw more thoughts into the chamber this morning, other than to say we all grieve. We grieve a very difficult year, and as many members have said, for some people more difficult than for others, for our seniors in long-term care homes, for marginalized people, for Indigenous communities. But it's hard to do a list without leaving someone out. I wanted to think about the moments where we were at our best through this last year. I think the first few months of the pandemic, we displayed virtually no partisanship. I can clearly remember, of course, that every bill that was passed up until September, we passed unanimously. But particularly those first 3 months, those first 3 or 4 months, voices on the phone, listening to daily updates and briefings, which happened on Saturdays and Sundays as well from our civil servants. You couldn't tell when someone opened the microphone to ask a question if that voice was a conservative voice or a liberal voice, a green voice, a voix de Bloc Québécois, or an NDP.
A Bloc voice.
The same things. Can we get help fast enough? Can we help people? Can you please regard the credit unions the same way you look at the commercial banks? Can we please do this? And I want to call to us because while we commemorate a year of COVID-19, it's very clear it isn't over. Our ability to get through this and to save lives depends on us bringing back the best of ourselves and setting aside partisan advantage. I know it's deeply baked into our DNA to try to take shots on both sides, government, opposition, whatever. But please, Canadians don't want to see us trying to gain partisan advantage, thinking about an upcoming election. They want to see us work together, and that means provinces, the federal government, political parties here in Ottawa. In looking for empirical evidence through pandemic, which we do, we look for the science, we look for the evidence. Those countries that have done particularly well through pandemic have been marked in the media as those led by women leaders. I want to mark one other thing, and this is about not scoring a political point myself, but making a point about political culture. Those countries that have women leaders have another thing in common. They don't use the first past the post voting system. Our voting system encourages gotcha politics. The system of awards, reward and punishment for conduct goes towards rewards for doing the mean thing, reward for finding the dog whistle, reward for the wedge issue. Now's not the time for that. Even though we still live under first past the post, I urge us to behave and to judge our conduct as though we didn't, to pretend that we really are able to say we collaborate today because we know we can collaborate tomorrow and it won't hurt us at the polls. We need, for however long this lasts, to bring out the best in ourselves as we did at the very beginning of the pandemic when we set partisanship aside. I love you all individually and collectively. I really, truly do. We have to do this together. There's no other way. We're now in a race between vaccines and variants. We have people who will be safe soon from their vaccinations. We have people who are still at risk. And our society as a whole, our ability to triumph over adversity. That we will mark best when we conduct ourselves in ways that suggest there are no parties here. God bless you. Thank you.